Hello everyone. Myself Dr. Sanjay Bora. I am a gynecologist working in Nuclear Power Corporation Hospital, Kakrapar site. Today I will be discussing a very important topic in women's life, that is preconceptional counseling. This video presentation will be very helpful for all those couple who are planning their pregnancy in near future or who are planning their pregnancy for the second time. This is basically an educational video to spread awareness between one and all. I will be discussing what is preconceptional counseling, what is its importance, what is its goal. Basically, preconceptional counseling is a guidance provided by your healthcare provider or a gynecologist at least 3 months before you plan your pregnancy. It has been seen that if you plan your babies, they are healthier. The concept of preconceptional counseling is very prevalent in Western countries. But what we have seen in our Indian OPD, 90% of pregnancies are not planned and they are hardly aware of preconceptional counseling. The importance of preconceptional counseling lies in the fact that there are so many pregnancies which are complicated, with preterm birth, with low birth weight babies, with birth defect, or pregnancy itself may be associated with complications like hypertension, diabetes, etc. Another very important part of preconceptional counseling is that the most important part of the fetal growth is during first 3 months. Most of the organs, if you can see in the chart, the central nervous system, the heart, arms, eyes, everything develops between first 12 weeks of pregnancy. Therefore, if a lady conceives but she comes to my OPD at 6 weeks or 8 weeks, then it is too late to prevent so many abnormalities. Fetus is the fastest growing organ in the body. If you see, most of the heart defect, it happens between 35 to 56 days. Lymph defect between 21 to 36 days. Therefore, if you come at 6 weeks or 8 weeks, it is difficult to prevent such type of defects. The main goal behind preconceptional counseling is to impart the knowledge, change the attitude and behavior of the couple towards pregnancy. It is also to screen all the high risk cases and to intervene at right time. Another important part, if bad obstetrical history we is to call, the abnormal baby during her previous pregnancy, we would like to reduce such type of pregnancy as far as possible. The final goal of preconceptional counseling is to have a healthy mother and a healthy baby. The assessment which will be done by a gynecologist is the age, very important part, because once the age of the lady is more than 35 years, her fertility is reduced. And moreover, if the couple, both of them are aged, there are added complication of abnormal pregnancies, not only abnormal pregnancy but abnormal complications during pregnancy as well as congenital defect of the baby during pregnancy. Body mass index, it is very important because it has been seen that if the body mass index is higher side, those pregnancies are more complicated with diabetes, hypertension and other complications of pregnancy. Therefore, we would like to advise the lady to to get her body mass index between 18 to 25 as far as possible. We'll try to regulate her menstrual cycle if it is irregular. Moreover, we'll like to advise her the fertility period, which is the most fertile period to conceive. If she has a family history of abnormal pregnancies, we'll like to evaluate and try to reduce abnormal pregnancies, genetically abnormal pregnancies. And lastly, personal history. If she has a personal history of chronic disease like hypertension, diabetes, asthma, epilepsy, all these type of disease, chronic disease, in such situation we must modulate, or sometimes we have to change the drug which she is taking. Diabetes is very important. If you are not maintaining your sugar level below normal just before pregnancy, there is higher risk of complicated pregnancy, and congenital abnormal babies are higher if the sugar level is high. Similarly, in hypertension, we have to switch over some drugs to safer drugs. Asthma, we have to change the drugs to inhalation. If she is taking drugs for acne, we have to change the drug because it may cause congenital abnormality. Anti-epileptic drugs causes lot of congenital abnormalities of the baby. It has to be controlled and regulated. We'll try to evaluate sexually transmitted disease, HIV, and we'll advise her to quit smoking as well as alcohol because they causes abnormalities in the baby. Most important part of preconceptional counseling is to know the vaccination status, whether she has taken rubella vaccine, because German measles, which is called rubella, causes congenital abnormality of the baby. So if she has not taken rubella vaccine during her childhood, we'll advise her to take rubella vaccine. Similarly, we'll advise her to take chickenpox, HPV vaccine, and nowadays COVID vaccine and hepatitis B vaccine if she is working in a high risk setup. Investigation: complete blood count. We'll like to see her hemoglobin level and would like to maintain her hemoglobin at 11.5, because most of the pregnancies which happens in India are anemic. Blood group level status: if she is RS positive or negative. If she is negative and husband is positive, special care need to be taken during RS negative pregnancy. Similarly, as I have already told about blood sugar level, the thyroid status is very important nowadays, because it has been seen that if the lady is having hypothyroidism, the status of thyroid hormone level during pregnancy is different from normal. Therefore, if it is hypothyroidism, then the baby can have intellectual disorder. Therefore, we definitely like to control her thyroid status before conceiving. Vitamin D3 is very important. Like in any other situation, we like to maintain her vitamin D status. Most important supplement during preconceptional period is folic acid. You can see in the slide. Accordingly, we'll prescribe the dose, and if she is having previous history of diabetes, anti-epileptic drugs she is taking, or having congenital abnormality, we'll like to increase the dose. Iron and calcium is very important during pregnancy. Iron to correct her anemia, calcium to help the musculoskeletal growth of the baby. Folic acid not only helps to prevent such type of neurative defect as you can see in the slide, but it is the vitamin which helps in the multiplication of cell. We'd like to start folic acid 3 months before pregnancy so that we can prevent such type of defect and so many other defects. Counseling is also done for the better half of the lady. because there are so many changes which are happening during pregnancy, starting from mood swing, nausea, vomiting, depression. And if your better half is unaware of different changes, hormonal changes which is happening during pregnancy, it is very difficult for her to pass through different phases in pregnancy. So we'd like to aware him about different phases of pregnancy. He has enough knowledge to cope up with different situations in pregnancy, and he becomes a better father for his child. Finally, to conclude, my take home message is preconceptional counseling is a very important part before pregnancy. I would like to see India with every lady coming for preconceptional counseling, which is very less nowadays, because it ensures the woman entering her pregnancy, not only the woman, the couple entering her pregnancy in the right state of mind, which is safe for both the mother and the baby. The present scenario in India must change, and with this short video presentation, I do hope my viewers who are sparing their precious time will go back to your friends, family or colleague, whoever were planning their pregnancy, share with them this video so that they can have a better pregnancy and a better child in near future. Thank you each and everyone.